Good afternoon, ladies and gentlemen. Welcome to this new segment and episode of Medcast, your gateway to the new healthcare updates and the replies to the rumors we have in the society. Today, we are so pleased to have again Dr. Dhari AlEnzi, who is a graduate of West Virginia University from the United States of America, and he's specialized in prosthodontist. Welcome, Dr. Dhari.
Thank you very much for having me again.
I wish I had said the name very well.
Yes, you
Yeah,
did.
okay, that's right. Thank you very much. Dr. Lari, in the last episode or the last segment, we have discussed the veneers
Mhm.
and what are the veneers.
Yes.
Now, because we have ended up the last segment with speaking about there are some risks about doing the veneers, and you also mentioned there are some benefits, and hopefully we can have enough time to
Yes.
discuss the benefits.
Mhm.
Now, let's start with the risk. Is there any potential downsides of making the veneers?
One of the greatest problems that we were having is unqualified dentists trying to make or trying to do veneers
Hmm.
with no adequate training. When we talk about veneers treatment, it sounds easy to so many dentists,
Hmm.
but it should be a very delicate treatment option.
And precise as well.
Yes, it has to be very
Yeah.
precise. You have to have the expertise to treat the patient. Whenever we try to make the veneers, we have to have a very accurate impression.
Hmm.
We have to cut the teeth in a perfect way. We have to cement the teeth later on and clean it very well to avoid any inflammation
Hmm.
that could happen to the gum around the veneers. Sometimes people cut too much from the tooth, and here's the problem. You cut more, you give the lab technician who's making the fake teeth more room to make them more beautiful.
Hmm.
So it depends on how much do you cut. Do you need minimal thickness or minimal cutting of the teeth? And if you remember last time we met, we did talk about a lot of patients who really need just a little bit amount of improvement. I don't treat them because it's not worth cutting their teeth.
Hmm.
So it depends on how or what is the change needed for that specific patient. If you don't cement the teeth well, or sometimes if there is a gap between the veneer and the tooth, a lot of bacteria will sweep in, and they started a cavity in there. Inflammation happen. Sometimes a root canal is needed later on. Um and some halitosis. If you know what the halitosis is, it's a bad smell from the oral cavity. So many things that could happen or go wrong with patients. Sometimes we have issues with the lab technician making the teeth. And
Hmm.
here's the thing, they look so perfect, but once the patient starts eating with them, they start to crack, chip. This happens a lot and depends on the lab technician and what he did. And you cannot know exactly what he did until you cement them in the patient
Yeah.
mouth. And the patient comes back later in maybe a couple of months, it's broken or something's wrong. Um, Also, I've noticed so many doctors, they don't adjust the bite, the occlusion. It's very important to have the bite corrected. They just cement them and minimal touch to adjusting the bite. Have you had any filling before? Once you're done with the filling, you feel something is high, and you tell the
Yes.
doctor, and
Yeah.
he has you bite on some paper that makes a mark and tries to adjust the bite.
Sometimes they tell you that you will get used to it.
Oh, that's
Yeah,
that's
that's wrong.
not
I
that's
know.
not right.
Yeah,
You can never get
because
used to it.
they say that there is you feel the difference because this is a new tooth. So with the time you will get used to it.
You will never get used to it. You will try to adapt. Your body will try to adapt to
To
it.
ignore it actually.
Okay,
Yeah.
but it will come back hunting you later.
Hmm.
Whenever we talk about the bite, it's an equilibrium between the muscles, the TMJ, the TMJ, the joint for your jaws, and the teeth. So it's an equilibrium. It's like a triangle. You have to fix all of them together to meet at the middle of the triangle.
Hmm.
You can never try to disturb that equilibrium. What happens if somebody tells you you will get used to it? You will have an issue somewhere. You either break the filling, you either break the tooth or move the tooth, or you will have a headache. I've been treating a lot of patients
Can
actually.
that happen as well?
Yes.
Will like that procedure will affect other parts of the body, as you said,
Yes,
like having a headache?
I treated so many patients who have been told they have migraine.
Hmm. And they
Only
didn't know
adjusting the
what is the
bite.
exact reason.
What is it?
I mean, they didn't know the exact reason
No.
after they underwent the surgery.
Everybody told them it's migraine. What happened is they thought it's migraine.
Hmm.
Nobody knew what it was. It was all about the bite, a feeling or something that happened during the dental treatments that they had that disturbed that equilibrium that we're talking about. So when we talk about the risks, we can talk for hours and hours,
Okay, now the point
but
is,
there's benefits.
yeah, okay, we'll speak about the benefits, but
Yeah.
there are some rumors related to making the veneers,
Hmm.
and I think you have mentioned some of them during your speech,
Hmm.
and you say that the bacteria might come in and make some complications in the future, but
Yes.
some people don't believe in making the veneers because they think within the time
Hmm.
they might deteriorate. So, to what time would you give the patient an advice to take care of the veneers to keep them as much as they can?
Okay, we try to build the teeth or make the new crowns to last forever.
Hmm.
Okay, and I should tell you about the patient who wanted to die with
Yeah,
the.
that story.
I did have a patient who wanted a smile to die because he was really dying. Anyway, uh, we try to make the teeth last as long as you can live.
But
We're not God,
yeah,
okay? And God made his perfect creations with, I wouldn't say flaws in his creation, but we are prone to disease.
yeah,
If God's creation is prone to disease, humankind creation is more prone to
prone to the
disease.
disease, yes.
So what I would say whenever a patient asks me that question, how long can my veneers last or crowns last or whatever treatment is, I can give him only the studies that they did.
Hmm.
And when we're talking about the studies, for example, when they looked at the smile or the crowns, they found out they talk about the success rate. When we
Hmm.
talk about the success rate, I can talk to patients about numbers more clearly. When I tell you that there's a 95% success, there is a 5% of failure.
Yeah,
Okay, but I will never know that you're one of this
either from
five
the
or the
95 or the
95,
5%, yeah.
and I can never know. And we're talking about studies who try to perfect each step on the way.
Hmm.
And this is what happens. We're not in a university setting to do a study on patients. When
Yes,
we talk about the general public and general clinics, it's not a study that we do. So sometimes the failure rate goes lower. And it depends
because of the
on,
self-experience.
yes,
Yeah.
and it depends on so many
Mm.
factors. Some studies are very accurate because they look at retrospective data.
Hmm.
Because, for example, they don't study from the beginning and they make you a crown and they study the success rate for 5 years in the future. They look at the past treatments and they try to get the numbers from. Uh, so I tell my patients it should last you as long as we can predict,
Hmm.
but I cannot guarantee. So yeah, you've heard about they some clinics they give guarantee
For
for
a lifetime.
lifelong.
Yeah.
This is BS.
Now,
Sorry.
can we say that totally depending on the way the patient is taking care of his tooth? Because some people think
Mhm.
if they do the veneers, as long as they are using the artificial tooth, then
Okay.
they don't have to to look after their tooth.
No, they have to. That and I've seen people who told me that yes.
How often?
Not very often, but I did have patients who thought that, okay, why do I have a cavity? I already
Yeah,
crowned it.
that's a point.
I don't feel anything. I did a root canal.
Yeah.
How do you tell me? We treated this tooth.
Mm.
That's the thing, because they don't realize we covered the tooth, but there's still something
Some
that can get.
minute opening that
Yes,
might be a gateway for the bacteria to
yes,
get inside.
yes,
Mm.
exactly. So we did have, I usually tell my patients, if you get crowns, you have to floss every day.
That's what always the
You
dentists
you
emphasize.
have.
Yeah.
Here's the thing. If you have diabetes, you have to watch what you eat. I
Hmm.
don't have diabetes. I don't have to watch as much as you do.
Yeah.
You know? Same thing. If you have crowns, you have to floss more than the one who doesn't have crowns.
Hmm.
So it's I always tell people, you have to double the amount of cleaning when you have to take care of them because it's very expensive to remake them.
Yeah.
And one of the biggest mistakes that happened, or not biggest, I would say one of the biggest mistakes, I would
Yeah.
still
It
say
is a mistake,
mistake,
actually.
when people ignore them and then they have to remake the whole smile.
Yeah.
It's more expensive, and they think they will pay the same amounts, like they're buying another car. No, you're being treated and it's a more intensive treatment. I have to cut the crowns or the veneers. I have to remove the cavities that I can find underneath them. I have to treat the gum around the veneers. I have to treat the root. I have to do the root canals.
Hmm.
It's more expensive. It's double the amount that you paid last time when you made the veneers.
The point is that some patients might not understand as well as with the
Mhm.
plastic surgeries, as they always say, the first attempt is always the best one.
Yeah.
If you go to the second attempt,
Yes.
as an example we
It's
have
a
here in the aesthetic
yeah.
veneers, it's not going to be the same. Never going to be the
It's not
same
the fun, and they usually compare the second attempt
with the
to
first
the
one.
first. Oh, it was much easier.
Yeah.
Why are you taking so long? Why is it taking 3 months?
The other problem we have, as we discussed in our previous segment, is that sometimes they compare themselves with another partners, as example.
Yes,
Like if they have like a brothers or sisters,
yes.
they do have the veneers. They come to you after they finish the procedure and they say, "No, my teeth is not the same as my
I
friend."
I did have that.
Yeah.
Yes. And usually sometimes I have to know the people that I'm working with. Um, so I remember telling one of my patients, please bring your sisters with you next time before we cement the teeth because
Hmm.
we had everything's perfect, but yeah, maybe the sister will say no, it's
No, there's
white,
a
it's
bit
too white.
difference.
It's I always and here's the thing, I usually tell some people that nobody's you cannot have everyone agreeing on something. I
Yes.
can tell you this color is pink. I see purple, but you will, oh no, it's light purple, not purple.
Yeah.
No, it's turquoise, or you know, you will have an argument everywhere. You
Hmm.
have it's the same thing happens with whenever I deliver smiles to patients. They go home, they hear something, and when they come back to me, I tell them, oh, they're jealous, you know.
Is there is
And sometimes it's
uh,
true.
if that happens, is there any way to step back the
Step back
procedure
from where?
for the procedure? I mean, if they have done it already and then they say, "No, I want my teeth back again," can
No,
you
they
do
can't.
it again?
If it's veneers,
Yeah.
it's there's no
There's
going
no way
back.
to go back.
Yeah.
I know some schools might prefer to do some sets of teeth rather than doing all the teeth around. Because,
Okay.
sometimes they say we need to do the teeth that is only shown in the smile.
Yes,
So to
exactly.
which school you would
Only
prefer to
the
be?
ones shown in the smart.
Which is like around.
There's no need to go beyond what can. And I always tell people, oh, but if I smile, nobody's seeing that smile, you know. And if someone tries to look into your mouth, hit them. You know, I tell you, it's too close. If someone trying to examine you, and in a social event,
Unless he is a
this is a
dentist.
creep. You
Unless
know,
he is a dentist. If
exactly.
he's a dentist, that's fine. If he's not, it's not.
So I tell people sometimes they're insecure about something that nobody can see.
Yes,
I
definitely.
tell them only the dentist and God can see that.
Yeah.
So you shouldn't worry about it.
Look, I'm not sure if we have enough time to discuss the benefits, which we may leave for another segment. But there's
I can
one.
summarize it to you.
No, actually, there's more important question I want to
Yes.
ask, and I need a brief answer for it because you have mentioned the pricing, and the second attempt would be more expensive than the first one.
Yes.
So you know that there are some people that might prefer to go outside the state of Kuwait to do their teeth,
Okay.
looking for cheaper price,
Yes.
and they don't even care about the skills of the technician he's working
This is
or
true.
even the dentist
This is
technician
true.
he's
Yes.
working. So to what is your comment on that
I
habit?
would say something very important, and I find myself obligated to do it.
First, let's have an agreement. This
Yes.
will be the last question.
What is it?
The last question.
Ah.
Okay, we'll leave the benefits for
Okay.
later on. Okay,
So don't, if you go outside for cheaper options, do anything you want. I'm not gonna stop you.
it's your choice.
Okay.
Yeah,
But don't do implants.
implants.
Don't do implants outside Kuwait.
Why?
Because implants, it's like having a car that you bring from outside,
And there's no
and whenever
warranty.
you have to change the oil, you can't find the parts, or
Yeah,
nobody can open it for you
yeah.
to change the oil.
Mhm.
If something gets broken in a year or two or three, you have to travel back to whatever country you did it in and stay there for a week or 2 weeks. It depends on what the treatment is, because you will not find
The same
the
material.
tools
Yeah.
to open or to touch these implants. Everything is fixable. We can fix anything in Kuwait,
Mm-hmm.
except if you place implants from outside that we don't have the parts for.
What about the
And there's
follow-ups?
so many, like it's so many companies that make implants.
Mm-hmm.
Every company has a specific design and a specific part, and you know,
Yeah.
if you come with implants from outside, usually there's no way we can help.
What about the follow-ups?
They have to travel. They don't do follow-ups. It's
So
so
you
cheap.
don't do follow-ups even in Kuwait if
We do
somebody
have
has done the
follow-ups here.
procedure outside.
What do you mean? Like for cleaning, they should have.
No, I mean if he's doing like an implant and
Okay,
outside, and then he
dental
comes
implant.
back to
Yes.
your clinic asking for a follow-up to that implant.
Okay.
So you won't be able
I would only examine it, but I
only
cannot do.
examining.
I cannot do. If there's a problem, I tell them about it,
Mhm.
but I cannot do anything. Yeah, I can't touch it.
Dr. Dari, I think we have exceeded too much behind our time. So we are so pleased to have you again here,
Thank you.
and hopefully we can have you again in our program.
Inshallah.
Thank you so
Inshallah.
much.
Thank you.
Our dear viewers, we have reached to the end of our segments with Dr. Dhari AlEnzi. Hopefully we can meet you again with another healthcare professional. Until that time, see you later.